All right, Nurse Crabtree is back with you here. This one we are going to do an IV change to intermittent infusion lock. So I'm going to again, the 6 patient rights, which is the right route, right drug, right patient, right dose, right time, right route, and documentation. Prior to entering the room, I'm going to double check on my MAR, my orders, making sure that I have the correct information. I'm also going to wash my hands upon entering the room, introduce myself, and explain the procedure that I'm going to be removing their saline. So first I'm going to shut off my flow here. So we've got that shut off. And then I've washed my hands already. I'm going to carefully remove the tape. And if it's super sticky, I'm going to go ahead and take an alcohol pad and just help ease up. I'm going to pull it tight and gently pull it off. Also looking at the site itself, making sure there's no redness, swollenness, and that looks good. I'm going to remove that. And I'm going to undo my port, and then this can just be discarded. I'm going to clean off. I'm going to glove up just as a precaution here. Never hurts to be over safe. If your gloves work. You would never do that in a nursing setting either. But your gloves usually would be working. We're going to have mismatch. All right. And then I am going to go ahead and clean our port here. And clean our, this is the same patient, so I'm just going to use it to flush 5 milliliters, making sure that everything's working well. Looks good. And then I'm going to explain to the patient to make sure to keep that clean. And the reason that we're going to leave it in their hand is so that in case of any additional medication or saline that we need to apply, we won't have to start a new one, that we can, as long as there's no reason or need to take it out, unless there was an order for it, that we'll just leave it in there to just save time and their hand and their veins. So then the next procedure that we're going to move on to is the IV push. Oh, and again, I checked the name of the patient and the date of birth. I double checked and verified with them upon entering, and also making sure the procedure. So then the second one here is the IV push, and we're going to check our MAR, the doctor's orders of what we are to do. And the doctor's orders say to give Dilaudid 1 to 2 milligram IVSP every 2 hours as needed for complaint of pain related to coughing. With that, I would call my physician to clarify the order, because it's very, do you want me to give 1? Do you want me to give 2? It's not specific enough. So I would verify with my physician the adequate dose that they are looking for. Once I verified that, I would also verify with the patient their pain level, and then prepare it according to the physician's order. So for Dilaudid, we're going to say that the physician said I could give 1 milligram. And on the label, here's my Dilaudid, it says to dilute it with 2 milliliters of normal saline and give Dilaudid 1 milligram every 2 minutes. So I'm going to go ahead and I'm going to dilute it with this. We're pretending that this is the actual dose of 1 milligram of Dilaudid. So we've already added in our saline to make the 2 milliliters on top of it. So we've got that ready. This is 1 dose. So I'm going to wash my hands. Again, the 6 rights of the patient, the right dose, right time, the right amount, the right patient, the right documentation. And then once I enter the room, I'm going to verify with them as well. State your name and date of birth so I can verify that. Yes, I've checked my MAR. I've checked before I went into the room the right patient, med, dose, route, and time. And then at the bedside, again, I'm going to check all of those one more time to make sure that is our 3-step check. So with that, I'm going to wash my hands. I'm going to glove up. I only have one glove left, so I'll have to pretend that I have 2 on. And so I'm going to get my flush ready here. And then I need my needle. And then I've got my drug and my alcohol prep pad. Okay, so first I'm going to flush our line with 5 milliliters. For video's sake and this hand's sake, I'm just going to push a little bit through. And also this pad originally would have been taken off, but due to the fact that this hand just kind of oozes out, I left the pad here. So after I have flushed it with 5, oh, sorry, I would have cleaned it first with my alcohol prep pad. And I would clean this as well. And then I would flush it with the 5. And then take that off after I'm done flushing. And my medication, my Dilaudid. So I'm going to clean off the top. And then I'm going to measure out my 2 milliliters. And I'm going to push in 2 milliliters to then extract 2 milliliters. Then I'm going to apply the safety, the needle. We're going to untwist that. And again, we're going to clean, pretend we have a wipe. We clean that off again. And then we're going to push, again, it's Dilaudid and it's diluted by 2 milliliters, so we're going to push it over 2 to 3 minutes for the doctor's orders. Again, verifying that the patient is who the patient is IV needed. And she was born 4/192. So I'm going to start my timer as I'm pushing Dilaudid. And for the sake of the video, we're just gonna slow down time and pretend that that was 2 minutes. We're going to remove it. Again, we're going to wipe off the end. Tell the patient, no we're not, we're going to flush it first, but I'm going to clean off the end. We're going to flush. Again, we would do 5 milliliters, but I'm, for the sake of this hand, going to just do 2. Discard of everything appropriately. Verifying, keeping things clean, sterile. And so then I believe that is that. And I'm going to grab some more alcohol pads. Will you pause it really quick?